Hip and knee osteoarthritis part 3, pain, relaxation and medication.
So what do we know about osteoarthritic pain? We know that arthritic changes on an X-ray do not correlate with the pain that a person may experience, and this highlights that other factors may play an important role. For example, someone with severe arthritic changes on an X-ray may not experience that much pain at all. Someone with mild arthritic changes on an X-ray may experience more severe symptoms. This shows that pain can vary from individual to individual, and that there might be other factors that could be significantly influencing your osteoarthritic pain. We'll have a look at those now.
So, first thing we're going to discuss here is joint changes. So, joint changes in somebody with osteoarthritis, such as cartilage thinning, osteophyte formation, and inflammation, are likely to contribute to this person's pain. Next, we have anxiety and depression. So it has been shown that in people with ongoing pain or long-term pain, including joint pain, that when these people are anxious or depressed, that this can heighten their pain or turn the volume up of their pain, if you like. Next, experiences. So for example, somebody with hip or knee osteoarthritis, if they have had a bad experience of, say, climbing a stairs, then this might influence that person's future experience of pain while doing a similar activity. So in the 1995 British Medical Journal, there's a case recorded of a man who was working on a building site when he stepped on a nail. So the nail went through his boot, and this caused him really extreme pain. So he went to hospital and had an x-ray, and the x-ray actually revealed that the nail had gone between his toes and that he had no physical injury at all. So just the thought or idea that this man had done damage to his foot was enough for him to feel pain, though no actual tissue damage was done. So if we get back to the person who may have had increased pain during climbing a stairs, this person may then knowingly or unknowingly associate this activity as bad or damaging to their joints. And this could then actually increase the pain experienced by that person while doing a similar activity in the future. So what could make this a better pain experience? So a person's health beliefs could definitely change this pain experience. So this person of having increased pain on climbing the stairs, so this person may have the health belief that pain when climbing the stairs equals the damage, so that pain equals damage to their joints. When we actually know that increased periods of pain for somebody with hip or knee osteoarthritis is normal and does not equal damage or further deterioration of the joint. So knowing this reassuring fact may then reduce the pain that person experiences when doing any similar activity, such as climbing the stairs, in the future. So next we have fear. So for example, somebody with hip or knee osteoarthritis may not be doing any exercise at all due to fear of making their condition worse. So this fear could be reinforced by family or friends, telling that person to constantly rest and be careful. But we know that if somebody with osteoarthritis does no exercise at all, then this will actually be more detrimental in the long term and likely increase that person's pain. So all these things give us an insight of what can directly or indirectly influence someone's pain. So the next slide is going to look at ways of managing long-term pain.
So what are the long-term strategies to help manage pain? So first here we have education and self-management. So now that you know a little bit more about osteoarthritis, you should feel a bit more reassured about remaining active and managing your condition moving forward. So over here we have physical activity and pacing. And we've already discussed the importance of these things in managing osteoarthritis going forward. Down here we have relaxation and pain medication. And now we'll discuss these in a bit more detail.
So why can relaxation techniques be useful? Relaxation techniques can be useful by reducing stress, reducing muscle tension, and assisting with sleep difficulties. What relaxation techniques can be used? Visualization, so thinking of a photo or a place where you feel relaxed, breathing exercises, or applications on your phone. You can also ask your physiotherapist from Nottingham City Care to direct you to our own relaxation video. So now we're going to talk a little bit about pain medication. So before we start, we do recommend that you speak to a pharmacist or your GP before starting or changing your pain medication to check that the medication does not affect your other health conditions or other medicines. So here you can see the pain medication ladder. Down here in the first step you can see paracetamol. This is often the first thing that your GP will offer you in relation to your joint pain. Second step up, we have our topical pain relief. Examples of this would be I Believe gels or Voltarol gels. This may often be taken in combination with paracetamol, but you do need to remember to consult your GP first. On our third step, we have non-steroidal anti-inflammatory drugs such as naproxen. Your GP may advise you to take these if your topical pain relief and paracetamol isn't relieving your symptoms. Right at the top step, we have our opioids. These are our morphine-based drugs, such as tramadol and Oramorph. There's no real evidence that these drugs help to manage long-term pain, and these drugs can be addictive. So next time you go to see your GP about your pain medication, it might be worth keeping this ladder in mind. We also advise that you do take your pain medication as your GP advises, so that it has its maximum effect.